Hi y'all, it's me, Dr. Gray. I am recording a somewhat different announcement this morning because I have some fun news. I'm gonna have a baby actually in September. My partner and I are super excited, and it's been really cool to be going through this process of growing a person while teaching child psychology. I have a couple of things I want to say about this because I just can't help myself. So when I first assigned the Apply project several weeks ago, I would have loved to use my personal life as an example, but at the time I was just not ready to tell people that I was going to have a baby because it was still pretty early at that point. I'm currently at 16 and a half weeks, so if you remember the chapter on prenatal development, you may recall that that is in second trimester, and it's around that time that you can start thinking it's around that time that your risk of miscarriage starts dropping. So at this point, we are pretty confident that if everything goes according to plan, in September, I will have a little human person, which is cool. But anyway, the story I wanted to tell you is that last semester, when I was getting an iron infusion, because I have low iron, I had a really bad experience with an IV placement. The nurse that was doing the IV placement could not actually find my vein, and so she just stuck the needle into my arm and kind of like wiggled it around a bunch to try to get it in there, and it really hurt. So after that experience, I formed a small fear of needles. I don't think it rises to the level of like a full-blown clinical phobia, but I was definitely anxious and nervous around needles. Another piece of personal history that you need to know is that I have a history of unprovoked blood clots. My doctors don't know why this happens, but my blood just clots when it shouldn't, and it's quite dangerous. It can kill you, and it's especially dangerous during pregnancy because the changes to your blood flow and all because your body is changing and all of the hormone levels fluctuating make you at higher risk for blood clotting during pregnancy and especially in the immediate postpartum period. So normally I just take a oral anticoagulant medication. So anticoagulant makes your blood stop coagulating or coagulate more slowly. However, you cannot actually take that same drug during pregnancy because the drug crosses the placental barrier, which is bad, right? You don't want the fetus to have the same medication that I am taking because that fetus blood doesn't need to be thin or anticoagulated. So anyway, I have to do a different kind of medication, and the only formulation that's available that's safe during pregnancy is available by injection. So what that means is twice a day, every single day, I have to inject myself with this medication. And for a person that was very recently, afraid of needles, this was a really tough experience for me. The first time I did the injection, I basically had a little meltdown. I like cried and it was very unpleasant, and I thought to myself, okay, you know how to fix this. You know what you can do to make this better. So I did 3 things. 2 of which are things that you have already learned in this class, and one of which is something that I think would be more appropriate in an abnormal psychology class, but is still worth talking about. So anyway, the reason I wanted to talk about this with the Apply project is because the strategies that I used are the strategies that, or are the concepts that I recommended you choose, or I required you choose, to apply in that Apply project. Number 1, I used classical conditioning. So you may already know this, but many fears are actually formed through classical conditioning. You have a bad experience, like with a needle, for example, where you experience a lot of pain, and you learn to associate that pain with the stimulus of the needle. And now every time you see a needle in the future, you have this conditioned response of fear or anxiety when you just look at the needle, even though it doesn't hurt yet. So I used what I know about counter conditioning to try to undo that association. And basically what you do to counter condition yourself is, once you have this recognition that something is classically conditioned, you try to replace that original conditioned response of fear and anxiety with a new incompatible conditioned response. So what does that look like? In my life, usually to undo this kind of fear response, you want to put yourself in a very relaxed and calm state of mind, because calm and fear are incompatible with one another. So you have to pick an activity that is very, very calming and relaxing for you. For me, it's a couple of different things. Sometimes I'll be talking to my partner. Most often I will be reading, if you can't tell from the little bookshelf behind me. I'm a big reader, and so reading puts me in a calm state of mind. So while I am doing this injection, I also use ice to numb the area, so there's a little bit less pain as well. All right, so I put myself into this calm state of mind by reading, and then I do my injection, and through the whole thing, I feel calm. The second thing that I do is I use operant conditioning, which is learning from the consequences of your voluntary actions. Normally, when you get a shot, the consequence is bad. It's painful, right? There's nothing I can do to prevent the pain of the actual injection of the medication. Numbing the skin helps reduce the pain of actually putting the needle in your body, but when you dispense the medication, that just hurts. Nothing you can do about it. So I make this a little bit more motivating by rewarding myself after I successfully give this injection. I know that there are some findings that suggest that it's inadvisable for pregnant people to drink any coffee at all. I find those results pretty convincing, but I made the cost-benefit analysis in my own life, and I decided that the risks of having a slightly smaller baby is okay for me, because I really do feel like I need a cup of coffee every day. It is something that I cherish. It makes me very happy, and I don't get a headache, which is nice. Anyway, so coffee is a reward for me because I only get 1 cup a day. So after I do my injection in the morning, I get my first sip of coffee, and I associate that reward with this voluntary behavior of giving myself the shot. In the evening, obviously, I can't have coffee because I gotta go to bed. So instead, I just reward myself with like a really nice piece of chocolate or something. And the last thing that I do, which is not something we've talked about in this class, is a strategy called cognitive reappraisal, or reframing. Sometimes it's called that too. In this strategy, you basically reason with yourself. You have to reframe the experience you are having as something positive, something that you want, right? So while I am giving myself this injection, I am saying to myself in my head, I want this injection. I want this medication. This medication keeps me safe. This medication keeps the fetus safe. This is a good thing. And I gotta tell you, I was a little skeptical about this before I started. I was like, I don't actually know that that's going to make this feel any better. That's going to make it less painful. But I'm here to tell you, 4 months in, it absolutely has. Actually, no, 3 months in, sorry. Because I only started doing this it's about 4 months. Anyway, whatever, doesn't really matter. I've been doing this for so long, I can't remember now. But I'm here to tell you that it didn't work right away, but it absolutely started taking effect, and reframing this experience as something desirable, something that is healthy, something that is good for me, has really made this medication something that, not that I look forward to every day, but it's definitely a part of my routine that I don't begrudge, I don't resent anymore. So I know this is kind of a long video, but I just thought it would be nice to tell you a little bit about what's going on in my life, and to make this opportunity to tell you all about how I'm not kidding when I tell you that a knowledge of psychology can change your life, right? Imagine if I didn't have this knowledge, I would be spending 20 minutes every morning and every night crying about this injection. But now, because I have taken the time to apply my knowledge of psychology, it takes me 2 minutes. And again, I don't look forward to it, but it's definitely something that I can do pretty easily. So I hope you have a great rest of your day. I hope you have a wonderful weekend and a really nice spring break. See you later, everyone.